week on Africa Health Check.
I feel like some point people got addicted to alcohol.
Watu wame drop out of schools, wanakunywa drugs.
We delve our discussion on substance use disorder.
We saw a very, very sharp increase in cases of people who are struggling with substance use, alcohol, marijuana.
And highlight steps we can take as a continent to stop the stigma around it. Good day and welcome to Africa Health Check, where we reflect on Africa's response to the COVID-19 pandemic. I am your host, Hohontle Jampaladi. Substance abuse is among the major social challenges that we face in our communities today. This is exacerbated by the stigma and discrimination that is attached to it that disenables those affected from accessing support services as well as healthcare services. On today's episode, we will be discussing substance use disorders. And to help me with this topic, we have our special guest panelist, Kendi Ashitiva from Kenya, who is the founder of Nisikize. We also have our usual commentators, Dr. Marianne Mureithi, the current chair of the Department of Medical Microbiology and Immunology and a senior research fellow at the University of Nairobi, Kenya, as well as Reverend Anthony Achampong, who's a pharmacist and a pastor from Ghana. But before we get into the discussion, let us have a look at this episode's feature.
My name is Isha Raza, most people call me Isha, and I'm the Programs Director at Africa Retreat Center. Africa Retreat Center is a specialized treatment facility for addiction and mental health. We are located in Kampala, Uganda, and we cater for people who are struggling with mental health challenges as well as addictive behaviors. I am an addictions treatment specialist, an addictions counselor, and also a recovery coach. And I am, as the programs director of Africa Retreat Center, I'm focused on helping people who are dealing with these challenges. In Uganda, the most commonly abused substances are alcohol, marijuana, of course tobacco, and now we are seeing the advent of an increasing opioid epidemic. And opioids are in terms of heroin and also prescription drugs like pethidine, which are beginning to creep in, as well as codeine. During the lockdown, which ended at the end of 2021, actually January 2022, we saw a very, very sharp increase in cases of people who are struggling with substance use, alcohol, marijuana, and also other behaviors. Mental health challenges came to light. Many people do not see addiction as an illness. They see it as a moral failure. And so society is very quick to judge when somebody is struggling with addiction. They see the person as somebody who has failed, who is immoral, who is morally questionable. And so with that comes a lot of trauma, and there's a lot of stigma around addiction. I struggled with addiction for 20 years, and it progressively got worse. I lost my jobs, my ability to work. I lost relationships. I lost a lot of what you'd call the worthy things in life. And by the time I was accepting the help that was offered, I'd nearly lost everything. I have seen countless people, hundreds of people, come from the pits of insanity or even death and get their lives back in order. So treatment works. The first step we need to do is to understand that addiction or even mental health is not a moral failing. The second thing we need to do as a community in Africa is to understand that most mental health problems, including addiction, are treatable, and that with with professional help, somebody who is struggling can actually overcome. So if you are struggling as a young person, the best thing you can do for yourself is to begin to talk about it, either amongst seeking professional help or talk to somebody and start having a conversation about the addiction. So I would want to encourage professionals, governments, NGOs to increase their cooperation, because no single one of us can deal with this problem. We like to say all hands on deck, everybody can do something, including you who is at home or in your car listening to this interview. There's something you can do about the problem of addiction.
And that is our feature story for this episode, where we will be discussing substance use disorders. As I've already said, we have our special guest panelist, Candy, who's going to be telling us more about her work around substance abuse as well as substance use disorders. I would like to welcome you, Candy, to the show.
Thank you so much for having me. I'm glad to be here.
Before we dive into the discussion on substance use disorders, just tell us a little bit about yourself. Who is Candy, your background, and how you came into the current work that you're doing?
So I am a practicing therapist, also known as a psychologist. I work in Nairobi, Kenya. I have a master's in counseling psychology, and I am a doctoral candidate of clinical psychology. I've done a lot of work in trauma care. I was part of all our two major terror attacks in Nairobi. I was part of that trauma care intervention. I also run a practice in Nairobi. So part of the work that I do involves helping people with substance use disorders, as well as their families. Because whenever you handle someone with an SUD, we call them SUDs. You're not just treating the person, you're treating the system.
Absolutely. And we are glad to have you and taking time of your busy schedule to just be part of the show as we discuss SUDs. Now, tell us more about Niskize. How did it start? When did it start? What is the motivation? And what is the overall vision behind Niskize? What do you hope to achieve with this initiative?
That's a great question. Thank you so much. So Niskize is a Swahili word that means listen to me. Niskize means listen to me. And because we are stationed at Nairobi, Kenya, Swahili is one of our national languages, and a lot of East African countries speak Swahili. So at the very core of a therapist's work is to listen to people. So we came up with Niskize, which is the platform where we serve our community. And the very first thing we did was to set up a call center. And we did this in 2016, at the time when the use of mobile phones and the access to the mobile phone was really, really picking up. At that time, we had almost 80% penetration of mobile phones, and mental health was still inaccessible for very many Kenyans. And so we decided, why not create a platform where Kenyans or anybody with a mobile phone within the region can be able to access us and speak to a mental health practitioner. So that's how we began in 2016. We've transitioned over the years, and there are many more platforms that have come up. And now we do a lot of face-to-face therapy as well, where our clients walk through the door with their families, their marriages, their children, and we offer those same interventions in person. It's been such a joy and an honor to serve our community, and we hope to do that in the years to come.
You mentioned SUD, Candy, as you're talking about the work that you do at Niskize. Maybe you could just briefly, define for a viewer at home what SUD is, not just the acronym, but just the entire spectrum, what it involves.
I'll be happy to. SUD stands for Substance Use Disorders. I'll say it again, Substance Use Disorders. It's a disorder or a mental health condition whereby you have used a substance. Here is either a drug, either a prescription drug or a recreational drug, to the extent where it has now become what you need for everyday function. All right. So you become you're called an addict because you need it just to function. And it's a disorder because now, because of this substance, you're unable to function normally in your professional life. So you're too drunk or too high to show up to work. Even if you want to show up, you just can't show up. Or you want to quit and you cannot quit. or this thing is bad for you, but you're not able to stop it. So when you talk about a substance use disorder, we're basically saying this substance is now in charge. Initially, you took it by choice. Now this substance is in charge of you, and it's controlling your thinking, it's controlling your behavior, it's controlling your choices. It is in charge of who you are. And we no longer have the person we have a person who has been hijacked by this substance. That's when we say someone has a substance use disorder. I hope that is clear.
Absolutely, absolutely. Maybe you can just tell us a bit about your reach. How far has been your reach? How have you been able to measure your impact since 2016? And what can you share in terms of just the impact and the reach of your work so far?
So what I can be able to tell you now, outside of critical numbers, is we have been able to serve more corporates than we were before. We have a lot more people walking in. We have churches and schools inviting us to speak to their students, to support their existing social structures. So we've been able to see a lot more people saying, can we partner with you? Can you come to our institution? I remember one time we had a therapist do therapy in mother tongue, which is a local dialect. So we had a gentleman call in, and he came from the Nyanza province. And fortunately, there was a therapist on call who was from that community. And I cannot even begin to explain to you how impactful it was, just being able to speak the local dialect, so because some things are lost in translation when we speak English. So that was such a joy for me. So I do have a little bit of those exciting moments where we've been able to see people that would not have otherwise seen a therapist, but then now a therapist was brought to them either through technology or through a contact that said, I saw you on TV, I saw you on this interview, please come to my church, please come to my community, please come to my school. That has been fantastic. And I'm truly, truly grateful for that.
Absolutely. Lovely work. I want us to talk more about the stigma and discrimination, as well as prejudices attached to substance use disorders, particularly to those affected, because this disenables them from accessing services that could potentially help them save their lives and even help them overcome the abuse of the substances. But we're going to do that on the other side of that. For now, it is time for us to hear what people on the street had to say.
And there is another issue here, there are so many people who are facing various challenges, regarding their mental health, but they can't accept to go, get, medical help or treatment. So those are the major challenges.
I have a friend who is having a drug addict and is getting some treatment, but the recovery has been slow, and most times they need help.
Yeah, we have a lot of people with addiction, but I don't think there is anybody who is seeking, because then they don't have anything to do, we can say. So they don't need being sober, they don't want to be sober, they don't face the reality of the life.
Welcome back. We've just heard from the word on the street. You're still watching Africa Health Check, and today we are talking about substance use disorders, SUD. Just before the break, we heard from our expert, Candy, who was talking about all the wonderful work they're doing, offering virtual as well as in-person counseling services for different SUDs through the Nisikize initiative since 2016. Really, really, really lovely work that they have been doing. But now I want to bring in our other commentators, Reverend Achampong, as well as Dr. Marian. I want us to reflect on the stigma attached to SUDs. I'm going to start with you, Reverend Achampong. Maybe give some reflections about SUD prevalence in Ghana and some of the initiatives that you've undertaken from the religious community to help address this major social challenge.
First of all, let us understand that substance use disorders, mental health problems in these areas are not communicable diseases. And I do believe that proper education is one of the, or will be one of the ways to deal with them. Many people don't know much about mental health issues, mental health disorders. Maybe from the young children, 13, 14, 15 years up, they don't know anything so much about drug abuse and things like that. So proper education, enhanced proper education should be one of the tools to handle that. Secondly, I think that there must be a way by which we rather turn the coin to also attack and even stigmatize those who popularize, make drug culture a popular thing for young children, young adults, the youth to be enticed, because people want to be like, celebrities who indulge in drugs, those in the sports arena, in the entertainment arena, and things like that. And so there are people who condone and actually advertise the use of drugs as something that, no, society should rather turn the coin and then lambast them and criticize them and make whatever they try to put out there and not acceptable to community, not acceptable to the youth. The other thing I'll also say is also to help education of let's say our public healthcare officials, nurses, physicians, physician assistants, because all the literature indicate that even health care workers know a little about, not much about how to handle people that are caught up in this net of drug abuse. And so it drives people away. People don't want to come forward for treatment. And the sad cases are where once in a while you hear a young man or a young lady commit suicide because of the social stigma. But I think that we should come together, the government collaborating with, let me call it social solidarity. Let us all come together to assist people that are caught up in this kind of menace in our societies. Yes.
Absolutely. Coming together and also the capacity building of the service providers. I think those are really profound contributions. Dr. Mary Ann, reflections on the stigma and discrimination and prejudices attached to SUDs. How do we overcome this? What is it that we're not getting right about these?
First of all, this is a very important topic, and I would like to also highlight, even in the medical world, there's that SUD problem in that, as you can imagine, you're exposed to all these drugs, and drugs don't have to be the recreational ones. They could be the ones that relieve pain, or and those ones particularly, such as morphine, pethidine, can have a very addictive nature. And because of the exposure we have towards them and the effect they have, you'll also find some people in the medical field, healthcare workers, also somehow addicted to them, such as even cough syrup. And that's something that we need to highlight and not shy away from having a medical profession having such an addiction. But then how do you deal with that? Because we know them, we see them, their work output is not at par, and you can see when their decision-making is a bit compromised. And again, the other thing, we somehow tend to stay away from them, don't involve them at work, and that also now creates stigma, creates depression, and now that depression may lead to suicide thoughts and tendencies. And one thing we are trying now to create is to now have these real conversations that we are having right now and acknowledge that there's a problem. And once we acknowledge there's a problem, is now to create solutions. How do you create these solutions, and how do you make it anonymous? And it's really interesting to hear what Kendi has in her organization, what she's doing. And in my setting, I deal with a lot of young students and young people in the healthcare field. We've created a sort of an app, which again, the students can access this, and the young people, the young professionals. And at the end of the app, there's an interface where they have access to counselors, access to several professionals who can take them through the different problems they have, be it case addiction, be it case any other thing. And that has really opened a channel of communication that was not there before, because there's that aspect of being anonymous. You don't want to suffer that embarrassment, which is against associated with stigma. So if we can create a way in having this really marginalized population, and here I'm talking about the healthcare worker as the person who is suffering from this special addiction and stigma, where they can then have a tool and apps where they can talk freely about the problems they are facing, and not just healthcare workers who I'm terming as marginalized, but also the adolescents, the young women, as I say, people who are facing abuse. That again, if you can talk about it and destigmatize some of these aspects, will go a long way in having a better society and a better community. And healthy people, as you always say, is wealthy people is a wealthy nation. Wealthy nation has healthy people. So yeah, we should keep that momentum.
Absolutely agree with you, Dr. Marianne. And I think you're bringing a really important element, which is that SUDs is not something that affects only a certain group of people. You know, it can affect anyone, regardless of your social class, regardless of your income, your academic background, your wealth or lack thereof, you know, but any of us can be affected by this. Any of us can become a victim and survivor of SUD. And all the more reason why we should all want to make sure that we raise awareness and overcome this. I'm going to go to Candy. Maybe you can share some of the successful ways that you've been able to raise awareness around reducing the stigma and discrimination attached to SUDs, and also what more, from your perspective and your experience, needs to be done by different stakeholders to address these prejudices.
Thank you. That's a great question. I'm so glad to hear from Dr. Marianne and her vulnerability, just her ability to say that indeed doctors can also be SUD patients. And that is very true, Dr. Ari. And, you know, we can attest to how much pressure doctors have been in during the COVID-19 pandemic. Doctors were literally the frontliners, the people that are at the front of the war. So indeed, very many doctors became victims of SUDs, victims of depression, victims of all these mental illnesses that affect everyone else. And I'm glad that we're now beginning to see that doctors are people too, and they're human beings just like the rest of us. One of the things I really appreciate about our generation is that we are a talking generation. You know, previously, our fathers, our forefathers, they never used to talk about these things. So one of the things we're doing to raise awareness is by increasing our ability to talk. And platforms such as the one we have, social media, journalism, the app that I'm talking about, is increasing our ability to talk. The thing about SUDs and all many other mental health challenges, they're kept in private. And anything that is in private, anything that is a secret, tends to attract shame and guilt. So one of the ways we are destigmatizing this whole issue of SUDs is by saying we're going to shout on the rooftops that this thing happens and you can get help and it's okay. It's okay to get help. And it's okay. Like I put up a post, my latest post on social media is, which is something I truly believe. I said, it's very, very hard to love an addict. It is true. They're very hard to love, but they need all the love and compassion we can give them. All right. Mm-hmm. So I put it out there and I got people writing and commenting and saying, it's so true. They are so hard to love. They're so difficult. But indeed, that's exactly what they need from us. Love and compassion, because nobody wakes up and says, you know what, I'm going to screw up my life by becoming a drug addict. Nobody does that. Mm-hmm. Nobody wakes up and says, you know what, I'm just going to become a junkie and ruin my life. No, it's not a choice. Addiction is not a choice. It's a disease. It's a challenge they have. And neither is it a knowledge gap, because people say they don't know, so let's tell them it's bad. No, they know, they just have a problem stopping, all right? So the more we talk about it, the more we normalize it as a challenge, that indeed their brain has been hijacked by this chemical or by this behavior, the more they realize the same way your kidney can have a problem and you need to have dialysis, and your liver can have a problem, or you can have diabetes. That's the same way you can have an SUD. your brain can be hijacked and you can have challenges stopping this behavior and stopping this addiction. So please come. It's the exact same thing. And just to tell them that, listen, there are doctors like Dr. Marianne, there are clinicians like myself who are trained and dedicated, and we are ready for you. We are committed to you. No one is looking down on you because you have an SUD, all right? And so just the fact that we're talking about it is something that I encourage. The fact that there are many platforms, something that I encourage, using our social media platforms, even influencers like yourself as a host, it's okay to put it out there and say SUDs are normal, they happen. We don't encourage them because they're difficult, but let's talk about it and let's support those that have it. I know it's hard to love them, but we need to love them, because if we isolate them, then we make it harder and harder for them to get help. And then they end up loving the bottle as their only friend. That makes it even worse. All right? Yeah.
Absolutely, absolutely. Really profound, Kendi. As we wind down and we're about to wrap up our show, I just want to go to each one of you and just with 1 minute, I want you to speak to an individual listening to this, who may be in a situation where they're affected or a patient of SUD, or maybe, on what role they can play, just a member of a community in helping us assist patients of SUD to ensure that they get the right support and access to healthcare services that they. Dr. Marianne, your 1 minute message to an individual listening to this right now, what is their role?
First of all, it's okay not to be okay. So please, we acknowledge the pain, the stigma, the suffering, or even embarrassment that you may be facing. But it's also okay that we are out there for anyone who seeks help. If you are seeking help, there are people around the community. So identify 1 or 2 people you can open up to. Could be your parent, if not a community worker or somebody who is a role model to you, or someone you can reach out to and talk through this. And if you don't have anyone around you and you have social media apps, there are several of them where you can talk to someone who can then walk you through any of these difficulties. We've already heard from Kendi, they have not just physical platforms, but even online platforms. So help is everywhere. Help can come in any format. So again, it's okay not to be okay, but there's help out there and people ready to assist you to make that first step of acknowledging the pain or even the stigma that you may face. And once you acknowledge that, there are several ways to overcome that and be okay. So that's my take.
Thank you very much for that. Really profound, Dr. Marianne. And Kendi, you have the last word.
The last thing I'd want to say to both the addict and the family living with someone who is addicted to something is, it's a tough road. I will not sit here and lie to you. Getting over any addiction is extremely difficult and it will take a while. So you know what? Let's sign up for it. It will take a while. We'll try many different things. We'll have a multidisciplinary approach. You may have a psychiatrist, a psychologist, a gym instructor, a nutritionist. You may have all these people that you actually need to help you, but please sign up and be patient. It may take a while. And that is okay. Many times when you start fighting an addiction, relapse is actually part of the recovery journey, all right? And that is okay. We're not gonna give up on you. We'll be here. We are here for the long haul, all right? So to both family and the addict, sign up. We'll cheer you on until the other side, yeah.
Thank you so much for such a powerful ending, Kendi. There'll never be enough time for us to really discuss these issues in full, but I'm really most appreciative of your time, Kendi, Dr. Marianne, as well as Reverend Achampong, for coming to shed a light on this SUD issue, as well as share your sentiments, your recommendations, and speak to an individual listening to this whom this may be something that closely resonates. As we wrap up this show, I want to emphasize or reiterate the words that have been uttered during this episode, that it's okay to not be okay. All of us at some point, we are not okay, and that is fine. And remember that it's a strength, not a weakness, to reach out for forces that avail to you. And remember that healing is a process, not an event. This is Africa Health Check. Make sure you connect with us on our social media platforms. We would love to hear from you. Until we meet again, same time, same place, same date. Remember that the future is Africa. The future is today.